new video about pontine stroke. You're going to see a gentleman who's 86 years of age who recovered quite well from a pontine stroke. We're going to show you a few photographs of his pontine stroke on an MRI. Introducing you to Kaplan and Brain Health. You may say, well, why do I want to be involved with Kaplan and Brain Health YouTube videos? Well, the concept is to try to help improve your own brain and to learn about the things that we've learned in neuroscience. The next video is going to be an 86-year-old gentleman who had a pontine stroke. You'll see a picture of a funnel with a little pea in it. The purpose of that little pea in the funnel is to show you that if a stroke occurred in the base of the brain, called the brain stem, or the pons in his case, that it could be quite a serious situation where if the pea was up higher in the brain, it may be a stroke that you wouldn't even realize and be a silent stroke, or one with just some very small deficits. And this, of course, is an important area like the visual cortex, excuse me, or the language center. But in this case, it was a very important center in the pontine area, which is demonstrated by the little pea in the pontine area, which is also located in the base of the funnel, where all the tissue from the brain up high comes down low, goes through the funnel. Hi, Douglas. I appreciate you coming in today for an evaluation. You remember about how long ago it was that you had your stroke?
Yes, I had my stroke about the 21st or 22nd of February.
21st or 22nd of February. And how did you know you had a stroke?
I found it very difficult to walk, and eventually I got to a point where I just couldn't stand up.
And did you call the ambulance, or did somebody call for you?
My wife came and picked me up, took me into the doctors, and they called the ambulance.
Okay, so you came right away to Waiketa Hospital.
That's correct, yes.
And your understanding is that you had high blood pressure when you came in?
Yes, I did. I knew I had these things, which wasn't helping me at all. And
when you came into the hospital, what do you remember? Could you talk, or could you understand people? What was your speech like?
My speech was very slurry, and I found it difficult to speak to people. And my right side was abnormal.
Could you walk?
Quite heavy.
Could you walk?
I couldn't walk at all. I couldn't lift my arm up, and I just couldn't walk at all.
So that was around the end of February, you say?
That's correct, about the 22nd.
And now we're at the end of March.
That's correct.
So you feel like you made a lot of improvement?
I would say where I am now, I feel like I'm about 90%. I'm just starting off.
That's fantastic. And so you're cooking independent? You can cook, you can clean yourself, you can take care of everything?
Yes, that's right. My wife and I live alone in a retirement village, and I would say I would be doing about 75% of the work there.
And before your stroke, how much of the work did you do around the house?
We just shared it 50-50, my wife and I.
Oh, so you're up 25%.
That's definitely.
That stroke's making you work harder than it did before.
Yes, it hasn't made any alterations to the pay. The pay is the same.
The pay is the same, huh? But maybe your wife appreciates it more, the extra 25%.
Yes.
That's great. And coming in today for evaluation, some of the things we're going to do is help control your blood pressure.
Yes.
It's still a little bit high.
Yes.
In the hospital it was good, but it's high again. Your cholesterol was a high, and we increased your cholesterol pill. So in the next few weeks, we're going to check your blood pressure again. We're going to increase your blood pressure pills, and we're going to potentially increase your cholesterol pill.
Yes.
Your sugar was a little high, too. We added a medication. Do you remember the name of that medication we added?
Yes, that's right.
It was metformin, right?
That's right, yes.
And we're hoping that brings your sugar down, because that's another risk factor. And after our conversation today, do you have a feeling about this concept of brain plasticity or neurogenesis? Can you tell me what we talked about that?
Oh, yes. with the explanation that you have given me and the diagrams that I've seen on the computer, I feel the way I've just come through has been quite ginormous, and understanding the whole concept of it now has really made me feel very lucky that I've come through the way I did.
Now, is it okay, Doug, if I could take a picture on the screen of your stroke that you had in a part of your brain called the pons? Is that okay if I do that?
Oh, by all means. I think this makes a big difference to anybody who wants to look at understanding it.
So when we talked about the pons, I know you never heard that word before. Probably most of our viewers don't know that word. How would you describe that part of your brain? What's the importance of it, or how does it do with connections to the rest of your brain?
Yes, it's just like a funnel, and the funnel from the top comes right down to where it narrows, and where the narrowing part is where, for me, is where the perpetrator was, and it was in that area that it actually closes the funnel outlet. So consequently, that makes it harder.
Right, exactly, because it's the narrow part of the brain. So if you have a stroke in that narrow part, everything going out of the brain can get all discombobulated, get problematic because the funnel gets clogged.
That's right.
Okay, so we're going to see if we can get a picture of the computer. Now we're taking a look at Doug's MRI, and you can see that this part over here in the brain is called the pons. If we look at an image just a little bit above or below, you can see this pons area looks clear on both sides. It's dark on both sides. Here on the left side, here on the right side, looks about the same. And if we look at another couple of images, now we're starting to see on this side of the brain there's a white area. That's where the stroke was. That's the pons. We take another image. We can see, here it is here, a big white area on the left side, and this side's dark. And that's the infarct. That's the stroke. We'll just go back one more time. There's a normal side. It's dark on both sides. No stroke. No lack of blood flow. And there it is there, a big area. Now we're going to ask Doug if he minds walking for us. Is that okay with you, Doug?
Yes, that'll be fine.
Good. Okay, Doug, let's see, show the audience, if you don't mind, how you walk.
Right.
Okay, thanks a lot. You usually use that walking stick? You can use it if you like.
Okay, it'll be better possibly.
Okay, yeah, use it. We want you safe. Before you didn't need a walking stick.
No, that's correct, yes.
Okay, good. Let's see you walk. Thanks. You got up just using one hand there to push up. Terrific. That's pretty good. All right. If you don't mind, you can kind of turn around and just come on back. So you've made a fantastic recovery. Have you had any falls since you've had your stroke?
No, I've never had a fall.
Oh, that's great. So you really get your balance. So you use your stick for a certain amount of confidence.
That's right.
Okay, well, thank you very much. And you don't mind that I use this for YouTube video?
That would be fine, thank you.
Okay, thanks again, Doug.